we have, the government will say we have the youth-friendly services, but are they active? And how many do we have? And you find these, the youths that we have are the ones that suffer. When we are told the youth-friendly services are there, even you yourself, when you work in that facility that has the youth-friendly services, the person you'll get being serving you there is an old woman or an old man. Even the language that they are using is totally not youth-friendly. So we are pushing on the implementation of the guidelines 2016 to be active and to be implemented, not just to be stated and they are not being implemented. Yeah.
Yes.
I want to know, this is not the first time that Pumwani having scandal. It has had a series of scandals before. And you as a civil society, the NGOs you have been there, what have you done to make sure that Pumwani is doing? And this, some women who are getting some problems that is those problems. What have you done? Because I know very well you're also funded and you can chip in and do something. So what have you done? Rather than coming in London to oppose the privatization of the hospital.
Thank you. I'll give a direct question to your answer. One, government is a duty bearer. Everybody pays tax to government to offer services. What NGOs do is to complement what the government is supposed to be doing. So where the government is unable, NGOs come in to support the work of the NGO, the government. Now, on the issue of how we do promote social justice, that's what you're asking because you're saying the issues have been there, which is true. We support those who need those services, to get those services from those hospitals. If you visit some of our hospitals, and I don't want to mention the names, then you will understand there are problems that need to be solved. And one of the things we are saying as non-state actors is some of these issues can be solved if all of us come together on one table and talk about these issues and find lasting solutions. One thing that we actually avoid nowadays to say that, but we are not bashing anyone. What you're saying is, can we collectively address some of these issues? So I know there are those NGOs that are actually doing direct service delivery for information. They provide drugs, they treat people. There are mission hospitals outside there, they're doing that kind of work. And there are those that work on governance issues. So maybe we want to have that kind of demarcation so that then it will help us move forward. But it is important that we look at health sector governance collaboratively if we are to move forward and avoid issues of having it so much politicized, because the moment you politicize it, then it loses its meaning, and then we are not on track as we try to address the challenges that we are facing as Kenyans.
Yes.
My name is Lydia. It's a really big concern. I'm from Data TV. Sorry. So it's a really huge concern for Kenyans. We've been having this case of corruption and other embezzlement of funds and everything, but do you really think the Kenyans will have to support you people? And we've been having promises. As a normal mwananchi, I'm told that I'm going to be given this tomorrow. This is going to change tomorrow. But again, how am I going to know if I'll benefit from what people are promising us Kenyans? And what projects maybe have you put in place so that we can have faith in the government or any kind of private sector that is going to help us in terms of our health and everything that concerns us? Because we've been having these promises. So what makes you different, and why should we believe you and join you in fighting for our rights? Thank you.
Thank you very much. I'll talk about the corruption bit. I think corruption is, in my view, should now be declared as a national disaster from where I sit. And you realize it's one of those issues that the government is actually, at the moment, trying to battle with. Civil society, through our other partners like Transparency International, are part of this agenda. And we are saying, look, service deterioration, the dysfunction of hospitals like Pumwani, partly or largely is as a result of corruption, for example. I mean, if everything is running smoothly, every other coin is being used effectively, efficiently to address the issue that it was supposed to address, I don't think we should be having this kind of problems. The problem is that we allocate monies, but we are never able to tell whether these monies were used for that purpose or not. And one of the things we are now doing as civil society organizations is to begin to get into these audit questions. The Auditor General always produces reports, but we realize all those reports are politicized the moment they come out. Meaning, they are not going to gain traction from any other supporter other than the civil society. And one of the things we are going to begin doing is to start doing our independent audits into some of these facilities, into some of our government budgets, where we find where we find discrepancies. Then we should be able to raise these voices. And again, there are institutions in this country mandated to actually handle corruption issues. Our work, for example, as civil society, will be to raise the voice, do the audits, get whoever is culpable, push them forward for other institutions to actually take over from there, because NGOs don't have the mandate to prosecute anyone in terms of whether they are corrupt or not. But I think corruption is not an issue that can be dealt alone by NGOs. I think it really requires what I would call collective efforts from the communities, from the NGOs, from the government, from the private sector, so that all of us then have one common enemy, who is corruption. Otherwise, if corruption is a threat to some of us, then it becomes very difficult for others to fight this threat.
So maybe apart from the audits, what else the projects you have in place?
Just to add on what he said, we all agree that good public sector should not go to privatization. A good public sector should never even think of going to privatization. So when we hear of private-public partnership between private institutions and public ones, we are raising this because it concerns us as a people. Our voice is not there at the table where this discussion is being held. We are not sure whether public participation was done before the county went ahead to discuss PPP with these institutions they are bringing upon. So we just want to ensure that whatever it is they are doing, they don't use that to conceal public interest while providing a platform for private investors to maximize on profit making. Because health is a human right issue. It is an entitlement to the people. So whenever there's a discussion to give or partner with a private investor on health, we just want to protect the public interest. So that's why we are speaking on this. We are not opposed to it entirely, but we want to ensure that the public interest is not concealed when these things are
done. Another question before we close. Because you spoke, let the other gentleman speak.
I'm John Mark from People's Daily. My question goes directly to the previous speaker, and maybe to emphasize on what my brother asked earlier. So I wanted just to ask, you had raised some issues, what should be done, and your suggestion as an organization. My question is, what makes you now different from Sonko? Because now the governor recently, we have known him as a populist. The moment he raised the issue of the Pumwani, there were some critics that is a populist, it was a populist move. And from your presentation, you have just admitted that currently you have any research on the same issue that you are talking on. So my question, I'm just asking, what makes you different from the same county that we are really criticizing on the same issue? Because currently, if I can ask you right now, you have chipped in as a technocrat and also as a professional. I thought of maybe you giving me some of the research from the whatever we are talking on, so that it can convince me more was than the governor's report.
Thank you. Let me answer your question. Now, thank you very much. First, let me state that we are part of a larger CSO organizations that are actually now getting into the issue of doing an audit into the entire healthcare system in Nairobi County. And that is the time then we will be able to say this is the report that we have as civil society organizations, and these are the issues, and this is how we want to move forward, from this point. Now, there are two things here. One,
Do that man finish first. Hiyo mzee anapiga simu.
I think it's done. All right, thank you. I was telling you that one, we're already in the process of doing an audit, and we want to do a comprehensive audit of the entire healthcare system in Nairobi County. Of course, focusing on partly maternal healthcare, but essentially the whole system, so that then we are able to realize what are the issues. And then once we realize the issues, we are able to say these are the suggestions. And then from there, our work as civil society organization is to ensure that the government then begin to implement what the suggestions are. That one is what I would term as both mid-term and long-term sort of intervention. The immediate intervention that we are having as we speak today, one is to look into the issues of what exactly is killing babies right now. And that we are doing as I speak. We want to find out what is it that is killing these babies. What is it that is the problem? So that then in the next few months, we are able to fix that. And I think the governor has already instigated a process through a committee to look into those issues. There is another committee under the Kenya National Commission on Human Rights, which is also doing that. And so to avoid duplication of roles, we decided to get into one of the processes as opposed to now starting another new process. The findings will be the same. And so we have two processes that are actually ongoing. And we are hoping once we get the findings, we should be able to move with speed to see how best then we can address that. Now, further to that, we are saying we need sustainable solutions. We do not want political solutions that will last for a month or for the next 5 years, then that is the end. Pumwani has been in bad books for the last I don't know how many years. Every year there is a case at Pumwani. And so next year we do not want to hear the same thing at Pumwani. And therefore that is why then we need to get back to the basics. What are the issues? Sustainably, how can we address these issues? I think that is the kind of discussion we are having right now. And I'm hoping sooner than later we can actually have a discussion with the county government over the same.
So then, I think we need to hand there. K24 requested for a repeat of just reading the statement because they came in late. So I think up to that point, we bring this to an end. Thank you very much for coming and being part of this press conference. So K24 can remain, and others, if you feel you want to maybe get more information, you can still remain and talk to the panelists. And we have copies of the statement.
It's me.
Just a moment.
Yeah, that's nice.
There are snacks outside here. we will especially take some Thank you.
Can you close this? Excuse me. Is it?
Okay.
Yeah. We need to start.
Okay. Are you ready? Yes. So let us start for the benefit of K24. This press statement was organized and prepared by the People's Health Movement. And People's Health Movement is a global network which brings together grassroots health activists, civil society organizations, academic institutions from all around the world, more specifically from low and middle-income countries. So we are over from around 70 countries around the world. So I will allow Dan to go ahead and read the opening statement.
People's Health Movement Kenya statement on the issue of Pumwani Maternity Hospital and the state of healthcare in Nairobi County. Our attention as civil society organization has been drawn to the ongoing matter at the Pumwani Maternity Hospital. Health is a fundamental human rights issue, and the government is obligated by law to provide quality health services to all citizens. There is no doubt that Nairobi County government is directly responsible for county health facilities and pharmacies as stipulated under Schedule 4 of the Constitution, Part 2(2)(a). The realization and enjoyment of Article 43(1)(a) on the right to the highest attainable standards of health, including the right to healthcare services and reproductive healthcare, squarely lies within the mandate of the county government. The convening of this press conference is informed by the deteriorating healthcare provision and retrogression of gains made in health service delivery over years. The interest is to safeguard the poor and marginalized communities and mothers in particular, that in their absolute state rely on public facilities as their remedy. It should be noted categorically that the dysfunction at Pumwani Maternity Hospital is not an isolated case, but rather part of the systemic failures of public health care in Nairobi County. It further illustrates the undignified treatment that patients experience in their bid to find affordable and quality health care. The issue highlighted in Pumwani are historical based on the previous happenings, including the miracle babies, the inhuman treatment of mothers, stealing of babies, and detention of mothers, among others. This must be strategically and objectively addressed to provide a sustainable and lasting solution. With this in mind, we would like to observe the following.
1, that the entire healthcare system in Nairobi lacks adequate monitoring and inspection, which would provide early warning and timely information on the state of healthcare in the county for action to be taken. The maternal and perinatal death review committees must be disbanded, and new committees that are representative instituted to help in addressing maternal issues in public health facilities in Nairobi. 2, the county government allocated 140,600,000 shillings through the county assembly to Pumwani in the financial year 2018-2019. We call upon the governor to instigate a process to track down on the use of the funds meant to improve service delivery at the facility level and bring to book anyone found culpable of swindling public funds for benefit for personal gains. 3, we would like to give the county government a period of 30 days to come up and publicly share a comprehensive report on the status of health facilities in Nairobi. The report will help in prioritization of funds from the county budgetary allocations to immediately address the resource gap that these facilities are facing.
Kuna concern ambayo nyakati hizi hizi facilities zitakapofanywa kuwa za kibinafsi, mojawapo ikiwapo Pumwani Maternity, maswali ambayo imeibuka ni ya kwamba akina mama wetu ambao wanatoka kwenye vijiji, je, wataweza kulipa hizi wataweza kulipa, kwa sababu zitakapofanya za kiprivate ama kufanya kwa za kibinafsi itakuwa ni jambo kama biashara na ni kulipa. So swali letu ni kuwa sisi kama wana PHM Kenya inafaa wananchi wahusishwe kabla hili jambo litekelezwe. Jambo lingine ni ya kwamba tunaunga mkono kikamilifu investigations ama uchunguzi ambao unaendelea na serikali na pia mashirika ambayo si ya kiserikali, tunaunga mkono kikamilifu, na pia tunaomba ya kwamba haya mashirika atakapoendeleza uchunguzi wao wapewe full support kulingana na katiba yetu ya Kenya ambayo ni article 35, wapatiwe full support.
So we call upon the governor of Nairobi to consider engaging civil society organizations in a structured manner to offer a third eye to monitor the hospital environment periodically in the county to ensure it is safe for patients, clinicians, and doctors. We recommend the county government to invest funds in the development of a synchronized patient data management system that monitors every stage of the patient's health from admission to discharge. This will go a long way in addressing negligence and issues associated with misdiagnosis.
We are aware that an inquiry was conducted under the directive of the Cabinet Secretary for Health, and the findings are out, which points out to human resources challenges, management failures, corruption, inefficiency in operation, and infrastructural deficiencies. We call upon the county government of Nairobi to take immediate and deliberate steps to implement and fix the short-term recommendations as we went deeper into long-term solutions.
So nitajaribu kuelezea kwa ufupi sana mambo ambayo tumeweza kuongelea hapa. Sisi ni kikundi ambacho kinajulikana kama the People's Health Movement. Na People's Health Movement ni kikundi ambacho kinaleta pamoja mashirika yasiyo ya serikali, wananchi, community health volunteers, professionals, watu wengi sana ambao wako na interest kwa mambo ya health. Na sisi leo tumekuja hapa kuweza kuweka sauti kwa mambo ambayo yanaendelea katika Nairobi County. Na sio tu Nairobi County, I think hii ni problem ambayo counties nyingi zina face. So Nairobi ni ile mojawapo tu ya county ambazo ziko na shida ambayo tunaongelea leo. So tumeongelea mambo kadhaa hapa kuhusu mambo ambayo yanaendelea katika county yetu ya Nairobi. But tunasema kwamba kuna zile shida ambazo zimekuwa historical sana ikilinganishwa na kaunti zingine kama Nairobi kwa mfano, ya kwamba mambo ambayo yanafanyika kwa mfano katika hospitali ya Pumwani si mambo mageni kwetu, ni mambo ambayo yamekuwa kwa muda mrefu sana. Na kwa hivyo matamshi yetu hapa ni kwamba tunataka tupate suluhu ambayo itakuwa ya muda mrefu na sio tena mambo ambayo yatakuwa yakifanyika kila wakati tukirudi kuongelea mambo ambayo ni the same. So tumeongelea mambo kama 6 ambayo nitajaribu kuyafafanua ama kuyaweka kwa ufupi. Jambo la kwanza ni kwamba tunaonelea kwamba ni kama kuna ukosefu kidogo ama ile monitoring and inspection ambayo inafanyika katika hospitali zetu si ile ya kiwango ya kutosha ambayo inaweza kupeana information kwa wakati ufaao, ili ya kwamba kabla tuweze kupata maafa tunakuwa tumepata information ambayo inaweza kusaidia kuzuia yale maafa. Kwa hivyo tunasema kwamba kuna zile committee ambazo zinafanyanga zinaitwa the maternal and perinatal death review committees katika county. Tunataka zile committees zitengenezwe upya ama kama zipo ziweze kurekebishwa ili zifanye kazi. Zile committees zikifanya kazi na maisha ya kwamba tutaweza kuelewa ni nini haswa inafanyika katika zile hospitali na itapunguza sana kwa ujumla maafa ambayo yanafanyika katika zile hospitali zetu. Jambo la pili ni kwamba tunaelewa ya kwamba county yetu ya Nairobi mwaka huu imeweza kuweka shilingi milioni 140 na 600 kupitia bajeti ile ya kwamba kuhakikisha kwamba hospitali zetu za county kama Pumwani inafanya kazi yake jinsi ambavyo inafaa. Lakini pia tunaelewa ya kwamba hizi pesa huwa kwa wakati mwingi hazifanyi kazi ambazo zinafaa kufanya. Kwa hivyo